Welcome. We have a great show, and we're jam-packed today. Our first guest, you've heard her before, Cynthia Warner, cardiologist at Providence, talking about the signs and symptoms of sudden cardiac arrest. Here she is with Shannon O'Kelley.
Dr. Warner, talking about cardiac symptoms and conditions that folks should not ignore. But I want to know what the difference between a heart attack is versus a cardiac arrest.
So your heart is like a home. It has a plumbing system to it, and it has an electrical system to it. In the plumbing system, this is your heart arteries or your coronary arteries that bring blood to your heart. Separate to that is your electrical system, and that is the spread of the electrical message throughout your heart that coordinates a contraction, heartbeat, and rhythm. So a heart attack is problems with the plumbing. If one of your heart arteries gets blocked and the heart muscle doesn't get enough blood to it, then that heart muscle gets compromised or injured. But the heartbeat and rhythm is still happening and is still being able to perfuse blood to the rest of your body. In sudden cardiac arrest, this is a problem of the electrical system where the heart suddenly stops beating, or it beats in a rhythm that's a bad lethal heart rhythm that doesn't sustain life. So sudden cardiac arrest is a problem of the electrical system of the heart. And how it manifests is basically you'll see a person just lose consciousness, drop, they'll have no pulse, and they're not breathing.
That is a sudden cardiac arrest. Maybe take a moment and describe the wiring of the heart and why it's so important.
Well, in terms of the electrical signal of the heart, like I said, it's the pathway that then determines your heart rhythm. And your heart rhythm is what is not happening to a sustainable level in cardiac arrest or not happening at all. You mentioned athletes, but the most common causes of sudden cardiac arrest are usually in people that have heart problems, whether they know it or not. So whether you have coronary artery disease, whether you've had a heart attack, whether you've had abnormal heart structure or cardiomyopathy or heart failure, those are the people that are most likely to have a sudden cardiac arrest. Now, there can be non-cardiac causes that lead to the arrest as well, too, such as underlying severe lung disease or severe injury like drowning or electrocution, as well as things like illegal drugs or really heavy alcohol use. So all of these things, but ultimately it leads to this abnormal electrical problem that's not sustainable with life.
And to fix this and to diagnose it, what is that process? And I mean, I'm asking, how would I know if I'm sitting at home that I have an arrhythmia, or how would I know to even reach out to you to get it checked?
So arrhythmia is very different. It just means we're having an abnormal heart rhythm. Some of those heart rhythms are totally sustainable with everyday life, and other ones that fall into the category of bad lethal heart rhythms can cause or predispose to cardiac arrest. The primary heart arrhythmia that is invoked in studying cardiac arrest is called ventricular fibrillation, or VFib. And what happens there is those bottom chambers of the heart, the ventricles, are not giving a coordinated contraction. They are just twitching. And so you don't have a meaningful heartbeat, and then that leads to this sudden cardiac arrest, which, like I said, will manifest with people suddenly losing consciousness, dropping, and not having a pulse and not breathing. If you see that happen to somebody, call 911, get the first responders there as soon as possible. For bystanders, it's to start CPR as soon as possible and have early defibrillation with an AED or an automated external defibrillator. That is the best chance of increasing survival. The survival rate for out-of-hospital arrest, even with first responders, is only on the order of about 10%. Act quickly.
Wow. Again, great information. Thank you for your time, Dr. Warner.
Thanks to Cynthia Warner, cardiologist at Providence, talking about the signs and symptoms of sudden cardiac arrest. Peter Bartline is our next guest right after this on Como.